research shows a massive three-quarters of all New Zealand doctors prescribe placebos to patients. And here to explain why is Dr. Shaun Holt. Let's explain first what a placebo is for anybody who doesn't know.
It's a drug or a treatment that a doctor will give that they know doesn't have a specific effect for that condition, but they want to give it because they want to give something, because just giving something can often have big effects.
So generally it's a bottle of pills that are sugar pills, or...
Well, no. In the old days, it was literally sugar pills, but they're not available now, apart from one product in America for children. But they're not really available, so the doctor has to improvise and give something else. So it could be things like antibiotics or vitamins, and that was actually one of the main findings of the survey we did, that antibiotics was the most common placebo prescribed, which is not great.
That is not great because?
No. Well, of course, you can build up resistance to antibiotics and give the person side effects. So in some ways, I think we'd be better like we were 30 years ago, where it was actually sugar pills.
And it's in a bottle with a fake label on
That's
it, essentially.
Right, yeah.
Is this necessarily a bad thing? The antibiotics issue aside.
It's a tricky issue. Our medical association doesn't have an opinion on it. The American Medical Association says that placebos are unethical, although the American doctors prescribe around the same rate as we do. My personal opinion, I think it's OK, as long as the doctor's acting in the best interests of the patient, not trying to deceive them to harm them, but thinks that, there's nothing else they can do. There's big benefits to be had from placebo. Why not harness some of that benefit? Haven't
you essentially broken that bond of trust between doctor and patient? Because you're lying to your patient.
Yeah.
Do they care? Do they mind?
Well, actually, a survey a couple of months ago in the New Zealand Medical Journal showed patients don't mind, as long as there's no good alternative that the doctor's missing out on, and the doctor's acting in their best interest. They don't actually mind. They trust the doctor. So it's tricky, as you say, because the doctor wants to help the patient. There's large benefits from placebo. No one's quibbling that. But then you've got to deceive. It's intrinsic to the use of placebo, so it's tricky.
The pictures we are seeing at the moment, antidepressant medication.
Yeah.
Is this the kind of thing that placebos are quite often useful for?
Yeah, I mean, they work for physical things like eczema and asthma, but particularly strong for psychological disorders, like depression. And in fact, some estimates say that 3/4 of the benefits from antidepressant medications are just the placebo effect. So very large effects.
And it works?
Yeah.
But it only works in sort of 10 to... Well, there's quite a broad spread.
Depends on the conditions.
10 to 90%, that's a broad spread.
So depending on the condition. So a physical condition, maybe only 10 or 20% of patients will respond. Something that's more psychological could be up to 90% will get a benefit. And those benefits can be up to 30 or 40% improvements.
And that makes sense. But what are some of the physical conditions that you could take a placebo for?
Well, like eczema or asthma. I mean, by day, I generally do asthma research. And, when we're testing new inhalers, we'll have a group on placebo, because we know they're going to improve 30% or thereabouts. And so the drug you're testing has to improve by more than that.
So doesn't that raise the issue of how much of, a physical ailment like that is all in your head?
It does, and this is why it's so fascinating. So there's a lot of research been done, a lot more needs to be done. It's a very interesting topic. We've got to understand the science behind it, and also you've got the ethical issues as well.
Are there any rules to be followed here?
No, and I think that's probably a good thing. I think it works at the moment. I don't think there's any evidence at all doctors are abusing it. They're only using it to try and help the patients. I think if you start putting rules and regulations, it may fall to pieces. So
and how does it generally go between doctor and patient? If I've come back in and tell my doctor I'm feeling so much better and thank you so much for prescribing that wonderful drug, and you say, oh, well, Ellie, it was actually all I have.
No, they probably wouldn't say that. They'd probably just let everything rest. The main reason for prescribing the placebo in the first place is if there's no alternative, but also if the patients are demanding medication, and that's a reality. Sometimes people sit there, I've got to have something, I've got to walk out with something.
And it's a reasonable response to that?
Yeah, I think so. Well, it's a practical response sometimes.
All right, Dr. Shaun Holt, thank you for your expertise.
Thank you.
You'd find that quite funny, though, wouldn't you? Shaun, I expect you laugh sometimes when your patients say what Ali said, don't they? When they say, oh, that was fantastic, doctor.
Yeah, I'll have
Thank
some
you
more
so
of that.
much.
Thank you very much.
It really bucked me up. You'd just go home, you'd be sitting in your car chuckling away at the end of the day, which is nice for a doctor. To be fair, though, I have misled doctors in the past.
Have you?
I have.
How did you do
I think
that?
a lot of people do. Well, you go and you sit down and they say, how are you feeling? Oh, I'm good. Well, you're not good, are you? You're at a doctor's.
That's why you're there.
But sometimes the doctor says, oh, and they ask you things and you think, oh...
I can't admit to that. I can't admit to that.
Well, not actually bleeding as such.